Focus, we're continuing to follow the efforts of neighbors pushing back against what they say is the saturation of these drug treatment clinics popping up in their Baltimore communities. Well, now they've taken their fight to the state capitol, and Trang Do was along for their trip.
Kelly, when a developer announced he would be opening a treatment clinic less than a mile away from where two others already stand, community members rallied to try to stop it from opening. Though they weren't successful, they helped to craft a bill that they hope will protect other neighborhoods in the state from being overrun with clinics.
Luckily for me, I went a different way.
Destiny Durso has come a long way. 6 years ago, she was a drug addict who'd hit rock bottom.
Everybody has a bottom, so, you know, I hit my bottom and had to kind of climb back up.
And she's still climbing.
I myself have been in recovery for 6 years. I've been working, contributing to society.
She shared her story in a Senate committee hearing in support of SB 199. Before approving the license of a new methadone clinic, the bill would require the Department of Health and Mental Hygiene to do an assessment of the need for opioid treatment in that zip code. Senator Joan Carter Conway of Baltimore sponsored the bill.
This is not about not in my backyard.
The bill was the result of several community groups coming together after work began on a methadone clinic near the intersection of East 25th Street and Greenmount Avenue. Two other clinics operate less than a mile away on Maryland Avenue. Durso says the close concentration of clinics are a breeding ground for criminals wanting to prey on a population struggling to stay clean.
If there's no regulation now, it's easy to stick them all together. But it's not easy for recovering addicts like me because this creates a big customer base for people who want to sell drugs.
The clinics are all in Baltimore City Councilman Carl Stokes' district. Stokes serves on the board of one of them and says he knows the good that opioid treatment programs can do. But he doesn't believe they should be one community's burden. A University of Maryland study of Baltimore outpatient drug treatment programs found that clients with the highest completion rates live less than a mile from their treatment center.
I think there should be a more equal distribution of such centers because people are in need across a wide and disparate geographic region.
Opponents of the bill say it could ultimately restrict access to treatment.
And we believe that this bill does not reach those goals.
Dr. Ingvild Olsen is the medical director at IBR Reach Health Services on Maryland Avenue.
We really need expansion of effective treatment across the state without requiring any extra steps in the licensing process.
Kathleen Rebert Franklin of the Department of Health and Mental Hygiene agrees, saying it is unclear how the department would use the assessment in the approval process.
There is no direction in this bill as to how the information is to be used, particularly the information regarding the crime statistics. It makes one wonder if there's more crime, do we approve an application? If there's less crime, do we approve an application?
One thing everyone in the room could agree on is that access to good, effective drug treatment programs is important and necessary.
I'm very supportive of these particular health clinics. I just don't think that they should overburden any particular community.
Delegate Mary Washington filed the companion bill in the House. House Bill 861 has its own hearing scheduled for March 3rd. And this is just the beginning in a very long process. If passed, the bill would go into effect in October.